Hi, I'm Linnea Allen, and I'm joined by Dr. George Mina, who is an interventional cardiologist at Ochsner LSU Health. Dr. Mina, thank you so much for being with us today.
Well, thank you for having me.
So before we talk matters of the heart, I'd like to get to know you a little bit better. So tell me a little bit about yourself. What are you doing when you're not saving lives?
So on the personal level, I am originally from Egypt. I'm married. I have two kids, 9 years old and 2 years old. I really enjoy spending time with my family. We love traveling together and visiting different places together. I really cherish that time with my family.
I would imagine you do, and with those two young kids, you're busy even when you're away from work.
I am, believe me.
What is your favorite place that you visited?
We went recently actually back home to Egypt after 10 years of not going there, and my daughter was very excited. She hasn't been there for a long time. She hasn't ever been there actually, and she loved visiting all the places in Egypt, and it was very good experience that we showed her where we came from.
Oh, that's wonderful.
Yeah.
Well, I'm glad that you enjoy that time with your family.
Yeah.
But I'm sure they're also very proud of what you do here at Ochsner LSU. So let's talk about that a little bit. You practice interventional cardiology. What is that exactly?
So interventional cardiology, cardiology is basically the field that treats heart condition. And there are so many specialties in cardiology. One of them is interventional, which the most common thing we treat is heart attack. We put stents in the heart. But there are a lot more that we do than just that. We treat valve diseases in the heart. We can treat vascular disease anywhere in the body, especially in the legs. Interventional coming from we're doing something to intervene, meaning that we do a procedure to open up a vessel or put a new valve or fix something. Yeah.
And you work here at Ochsner LSU, which is a teaching hospital. So tell me why it's so important and so special that we have a teaching hospital here in our community.
You're absolutely right. It's very special. In our department, we always have medical students, residents, fellows rotating with us, practicing under supervision. And many of those will be the future doctors in our community. As a teaching hospital, we really have a huge role in order to train those future doctors. We always make sure we have the most up-to-date equipment. We have well-trained and experienced doctors that we're able to provide that high-quality training to our students and residents. We have doctors that pretty much can handle all difficult cases, and that's how we become a referral center and leader in our community.
Okay. So now you mentioned a minute ago heart attacks. What exactly, we've all heard heart attacks, they had a heart attack, but what does that mean exactly?
So heart attack is when the blood supply suddenly stops to the heart. The heart is dependent on that blood to get its nutrients, and when the blood stops all of a sudden, the heart muscle will suffer from that lack of blood and will become weaker, and if not treated will eventually die. That piece of the muscle that affected by that blood vessel. So that is why it is very important that anybody with heart attack seek medical attention immediately and be evaluated by a cardiologist as soon as possible in order to preserve the heart muscle and get it back to normal.
And so what symptoms should people be aware of? If they have these symptoms, it's time to see a doctor.
So the most common symptom of a heart attack is chest pain. Usually it's patients describe it as pressure, heaviness in the left side of the chest. Sometimes they feel short of breath, nauseated, breaking out in sweats. And some people have more symptoms than others. But when those symptoms come all of a sudden, they are new to you, they are I mean, some people have chronic heart disease that they always have chest pain, but sometimes this becomes different. It is more intense, happens more frequently, lingering longer. So all the things, could indicate that a heart attack is happening.
And you often hear people talk about the arm. Is there something about, is it the left arm tingles? Or?
So the chest pain that comes from blockage in the blood supply of the heart could travel to the left arm or to the neck. We call it a referred pain. Usually some people actually, that would be the only symptom they have is the arm pain, left shoulder, left arm pain. It is important to know all those, different presentations of a heart attack.
And people shouldn't wait when they feel those things, correct?
Correct. The sooner the better. They need to seek medical attention immediately and be evaluated by the cardiologist.
So let's move on. We've done some pretty incredible procedures at Ochsner LSU. One is called the TAVR procedure, which, help me if I get this right, transcatheter aortic valve replacement. Sounds very complicated. Can you simplify that and tell me what that's about?
So TAVR is replacing or putting a new aortic valve. Traditionally, the way to treat that was to open the chest and do open heart surgery. But nowadays, we can do the same thing by a minimally invasive procedure called TAVR, which we go from the groin, the most common place, or we can access from different areas, but the groin is the most common place, like a heart cath, and put a catheter in the vessel in the groin that has the valve mounted on it, and push it until we can see it under X-ray where the old valve is. And once we see it, we deploy it there, whether with a balloon or let it deploy on its own. And once we make sure it's in position, we take everything out, and the patient will have a brand new valve that is functioning normally without having to cut the chest open.
Recovery has to be a little bit easier, right?
So recovery is very easy. We usually send home next day.
So if somebody had open heart surgery, how long would they be in the hospital?
It depends on how things went, but they typically stay for a week or so. Again, don't quote me on that one. I have to ask a surgeon, but definitely not next day. I can tell you that.
Wow,
Yeah.
that's amazing.
Yeah.
Okay, so you guys have done another procedure as well called the Impella. Tell me about that.
Yeah, in our department we do various procedures. So the Impella is a pump that supports the heart, takes the blood from the heart and pumps it outside the body, and that's pretty much what the heart does. We use it when the heart is so weak and not able to sustain the blood pumping needed to keep the patient alive. So we actually, again, go from the groin, and it's a catheter that we push until it reaches the heart, because all the vessels eventually will lead to the heart. So that's how we reach the heart with minimally invasive procedure. We just access the vessel from a distant location, and the groin is the most common. And we put part of it inside the heart, and we'll just take the blood from the heart and pump it outside. And we use this when like I said, when patients have very weak heart, can't sustain life on their own, or we can do it as a protective measure when we're going to do a procedure to open blockages in the heart, and the heart is already weak, and the patient might not handle the procedure on their own, so they need support during the procedure. So we just do it while we're doing the stent, and take it after we're finished.
So it's more of an interventional procedure, but it's not something you leave in the heart, is that correct?
So we could leave it for several days. It's not a permanent device. We can leave it for several days until the patient recovers. Like if you have a big heart attack that causes your heart muscle to become very weak, and even if we put stents right away, your heart is hasn't fully recovered. So they need that support, for a few days sometimes until they are back up on their feet. That's one way of doing it. The other way is, like I said, while we're doing a procedure, we only put it during the duration of the procedure, just to be a backup method in case the patient doesn't tolerate the procedure very well.
You guys are busy.
We are, thankfully. We love to take care of patients, and we enjoy doing what we do.
Okay. Well, we've talked a lot about interventional procedures and what you do when you see somebody who is having a heart attack or some other cardiac event. But how can people keep their hearts healthy so they don't have to be rushed to the emergency room?
So there are, it's actually one of the specialties in cardiology called preventive cardiology. So we don't want the people to be sick, and we want the heart to be healthy. It's very simple, and it's common knowledge, basically, starting with healthy diet, more vegetables, less fat, watching our weight, and exercise. If you are active and can do exercise, actually the recommendation is to do 30 minutes a day, 5 days a week of moderate exercise, or 15 minutes, 5 days a week of vigorous exercise. So it is a lot to keep up with, but if we can, I think we all should engage in exercise. It helps the heart muscle, it helps keep the vessels healthy, and maybe prevent progression of any disease that we have. Obviously, there are risk factors that we can try to keep under control. Some risk factors we don't have control over, like aging and genes, but there are a lot of things that we can control, like for example, smoking is one of the biggest risk factors for heart disease. Anybody who smokes, encourage them to quit, to avoid damage to their vascular system. Anybody who has high blood pressure, diabetes, they need to keep that under control, make sure they see their doctors to keep that in check, because studies showed that people who have uncontrolled blood pressure or uncontrolled diabetes tend to be at higher risk than the ones who have them under control.
And what about screenings? When people see their primary care provider, what kind of screenings should they be having for their heart?
So we do blood tests looking at the cholesterol levels, make sure that the lipids are within normal. We have obviously criteria for who should be screened and who should be not, but screening mostly blood work. If patients have symptoms, we can do more testing, but we really pay attention to symptoms and try to get good history and talk to the patient, because sometimes the patient didn't know that what they're describing is actually a symptom coming from the heart. So we try to identify what's relevant and what's not. But yeah, there are imaging that we can do as screening also in patients that we think are candidates for that. So that's why it's very important to see a doctor and get checked, and the doctor, I'm sure, will order the right screening for you.
Okay.
Yeah.
Well, you've given us a lot to think about. Is there anything that I didn't ask that I should have, or any last thoughts?
I just wanted to emphasize that at Ochsner LSU we have a really great team in our cardiology department. We have well-trained and skilled doctors who can take care of pretty much anything in the heart, and we enjoy treating our patients and taking care of them, and would love to help our community in any way we can.
Well, Dr. George Mina, thank you so much for being here with me this morning. And as he said, if there's anything wrong with your heart, be sure to come see us at Ochsner LSU Health Shreveport.